If you have pain in your shoulder, it could come from a variety of different causes, whether you were in an accident or you just reached your something the wrong way, reached for something. Our next guest has a new therapy that could relieve your suffering. Joining us now from New You Health and Wellness is the owner, Stacy Roberts, along with one of her patients, Pam. Good morning to both of you.
Good morning.
Good morning. I feel like shoulder pain is so common. You hear so many people talking about it. Can you talk about the types of shoulder pain that you see, Stacy?
Absolutely. So the shoulder is an interesting joint because it's a ball and socket joint. So you've got this ball stuck in the socket, and there's a lot of mobility in the joint. So because of that mobility, there's a lot of chance for injury. But one of the interesting things that we see in the clinic is especially women who are either perimenopausal or menopausal tend to have an increased level of shoulder pain, and that could be due to the estrogen levels decreasing. Because around this ball and socket joint, there's also something called a capsule, which is like a balloon. And sometimes if there's a minor injury or, again, hormonal changes, that capsule can shrink a little bit and make it more difficult. And then you get an impingement in the shoulder. So you get pain here, or it refers down here, or sometimes it goes up into the neck. And then all of a sudden you're limited in, reaching up overhead, trying to get your bra on in the morning, trying to wash your hair. And you start noticing these things happening that start to get worse and worse. So by adjusting that, doing some manual therapy on that capsule, and then utilizing the shockwave that we have here, we've seen some tremendous improvement with patients.
So happy to hear that. And I want to talk about the treatment in just a second. But Pam, first, if you'd share your experience and the type of pain you were having in your shoulder.
So it's in my left shoulder, but over a couple of weeks, all of a sudden I couldn't raise my arm up without having pain, and I'd have tingling down my arm, or I couldn't put my coat on because I couldn't reach my arm back far enough. So, and it just kind of kept getting worse. No matter how much stretching I did, no matter what I did at home, it didn't fix it. So I've seen Stacy for other things. So I figured, let's see what she can do for my shoulder too.
Yeah, I'd love to know more about that, Pam, because I understand that you did the SoftWave therapy as well as the manual hands-on therapy. Did you feel it was a combination of those things that helped you get relief?
It is. It really is. The shockwave gets really deep inside to your muscles, and that just loosens them up in order to relax them. So that way, when Stacy does her manipulation and does the stretching on your arms, it just increases that ability to pull it out farther and to get it to stretch out the way that she wants it to.
So how's the pain now, Pam? Have you noticed significant relief and significant reduction in your symptoms?
Yes. Before I could just barely raise my arm to maybe here. Now I can raise it all the way up to here without it clunking or having any pain. So
that's such good news. Talk to us a little bit, Stacy, about the technology you used and how you used it in combination with manual therapy.
So the technology is the shockwave technology, which you've seen before. And basically, let me grab it here. It's from a company called SoftWave, and there's a little electrode inside of this water here that when I press it, you get electricity that's pushing energy into the joint. Now, most modalities that you use only go on the surface of the shoulder joint, but this can get directly through that capsule into the shoulder joint. So that, like Pam said, when I'm doing the mobilization on her shoulder, I can really stretch that capsule out where I can't get that same thing with other modalities. It takes twice as long or 3 times as long to get the results that we get in 3 to 4 sessions. So it's been, for me, a game changer after being a therapist for 30 years, being able to apply this technology to get my patients better faster.
So then you do this, it penetrates a little bit deeper, you get that energy there, then you combine that with the manual therapy.
Right. So what shockwave does helps to decrease the inflammation. And then we do some manual therapy to stretch out that capsule. And then we re-educate the muscles basically on how to move. So if there's a rotator cuff weakness or even a rotator cuff tear, we help to improve the healing of that rotator cuff tear. But in Pam's case, there was no tear, there was an impingement. What was happening is that capsule got so tight that when she was raising up her arm, it was smashing against another bone. And then there's some tendons in there that get pinched. So there's an impingement syndrome, inflammation happens. Shockwave can decrease that inflammation. the mobilization that I do helps to stretch out that capsule, and then retraining of the muscles shows the arm how to move again without pain.
Wonderful. And can you tell by examining it, someone's shoulder, if they'd be a good candidate for this?
Absolutely. So I can, when they come in, like I said, having done this for so many years, I pretty much can tell, is this a rotator cuff tear that I'm going to need to refer out to a physician? Or is this a chronic issue over time that's from an impingement? Or is this potentially coming from the neck? Because some shoulder problems can come from the neck. So with an evaluation, we can narrow down the specific issue and then decide whether the treatment will work for them, or if they need to see like an orthopedic surgeon, which most of the time the orthopedic surgeons are sending me the patients because they're just not getting better, or people are coming in after they've had another physical therapy or chiropractic appointment and they're not getting the relief that they want. So that's when they're coming to see me as well.
Wonderful. Stacy, thank you so much. And Pam, congratulations on the reduction in your symptoms. It was wonderful to hear your story.
Thank you.
Thanks, Molly.
Yeah, thanks to both of you. And I want to make sure that people know, if you got shoulder pain, hey, right now, New You Health and Wellness has a $99 introductory offer that includes a consultation and abbreviated treatment. To start your road to recovery, call 414-299-8121 or visit newyouhealthandwellness.com for more information.